we started studying very, very closely the paper record system that is used in DRC. How were healthcare workers capturing public health data on paper, and then how were they transmitting it on another piece of paper to the health zone? And then at what happened at the health zone with those data? Well, then they were being manually entered into a more kind of open MRS system called DHIS. We were looking for potential off-the-shelf products that we thought we might be able to adapt to serve this purpose. That's when we began to kind of iteratively develop this app that essentially mimics all of the paper steps. So that's sort of why we decided to create this technology. You know, we think that the data problem and the community level data problem is so fundamental to being able to address any other problems effectively. We also have some other programs that we're working on in partnership with the business school at the University of Chicago. It's called the Booth School of Business. We have been working on some supply chain modeling for really hard to reach, really hard to service communities. And so we've been using our data sets, our community level data sets, to kind of create these models about how we might be able to bring certain types of products into these very rural, very fragile communities where that really hasn't been feasible before. The first point that I would like to make is that data should not be elite, okay? And that is because of the very simple fact that where data ultimately come from, right, should be from the community, right? Because, what does it mean to come up with a public health statistic? It means that we've aggregated, right, a significant number of observations, right, throughout the population that allows us to make an estimate about disease prevalence. We also know, right, that disease prevalence and certain burdens, right, that face communities are very heterogeneous. For us, that should inform everything, right? So the policymakers need to recognize that only through really accurate granular data sets at the level of all of these heterogeneous communities within a region or a country will allow us to design the most impactful and effective policies. We also recognize that there's a phenomenon right now in the world of kind of M-health. Just as we have, heterogeneity within countries, we have profound heterogeneity in between countries. It is very hard to introduce digital tools that can be adopted and where healthcare workers actually see their value and where their productivity is enhanced rather than detracted from. It's very hard, right, to achieve that balance. So we early on made the decision that we weren't trying to create a tool to scale across all of Africa. We wanted to make a tool that worked really well for the Democratic Republic of the Congo. So if we create the right kinds of tools that are going to give us an accurate picture of what's going on there, then we can make very significant progress in terms of decreasing things like malaria mortality, infant mortality due to other causes, maternal mortality, food insecurity, etc. One feature of our technology is that we don't need mobile phone connectivity, and we don't need electricity because we can install these solar charging units at health centers. And we have a feature in our app that allows us to grab all of the public health data from one tablet to another using Bluetooth. Then it becomes even easier, right, to use our technology, because then healthcare workers can upload their own data locally. This idea of the problem of data flow is something that I have discussed, over many years now with the people that I work with in the Ministry of Health. And so this idea now that there is sort of an agency that's devoted to thinking about all of the pieces of the puzzle to help to improve that public health, data flow, as well as appropriate management of those data, is, I think, a great development. So, we're really hoping that we'll be able to also find a community of practitioners locally where we can, work together to, enhance certain parts of the problem. It's important to recognize that we should use different metrics to measure different types of impact. Sometimes also during the course of doing experiments, we also learn about different indicators, right? Different variables, different potential, endpoints that also might be important for us to take up and consider at a different time, or to reanalyze data in light of things that we learned just from carrying out the experiment. So if we can get a bunch of health centers converted and we see, significant data flow, that would be a great first step. But it doesn't end there, right? Because then what would we want to look at? Well, we would want to look at accuracy. We would want to look more closely at those data that are flowing. And we would want to make sure, okay, well, do all these data make sense? Are people, entering in information correctly? Are there ways in which we can make slight changes to the app where healthcare workers are cued, to answer specific questions in a specific way? So for me, I see as sort of this arc of, of what we're trying to achieve over time. The novel coronavirus presented, a new layer of, challenge, certainly, but that mindset of, flexibility, figuring out how to get around, barriers and issues, it's a mindset that we've, always had to have in order to operate in the environment where we operate. The most important lesson that I have learned is be humble. Test what you think you know until you have the kind of rigorous, as objective as possible kind of sources, material, experience. Don't project. don't think that, because, you're really good at these 5 things in some other context, that you can automatically apply, that methodology in a new context. We're almost done with all of the clinical related data. And now we're doing the last bit, which is the administrative related data that is collected at the level of the health center. So that means, inventory management, HR registers, fees that the health center is supposed to be collecting. I was there talking with the various technical people in the National Ministry of Health about making sure we have the most up-to-date paper forms that we're working from, that we have identified collaborators at the national level that allow us to ask kind of deep questions as we sort of say, okay, so what are you really trying to capture in this column here? This register has all these columns, and And we need to deeply understand what is the question being asked, what's the datum, how does it code right into the report? What is the actual kind of set of steps and the set of thinking, right, that goes in to each of these forms. And so that's what we're tackling now. And that's kind of what's going to keep us occupied for the immediate future.